main reason I became a cardiac surgeon goes all the way back to 3rd grade when my teacher, who is an extraordinarily great teacher, Mrs. Matrani, brought a cow heart to class and literally with a knife in her hand said, "I need somebody to dissect this heart." Bill Kessler handed me the knife, and so not knowing what I was doing, I dissected the heart and I said, that's what I'm going to do. We often get asked why we put in the long hours and time when there's probably a lot easier ways to make money, but no place can you get what we get, where we actually have people entrust us with their lives. And then we get to, do our task and our gift upon them to restore life and health and normalcy of their lives. And a failing heart is just that. It's a heart that can't work strong enough to support your body anymore. And we've always had transplantation over the last several decades. That's improved. The medicines have improved. The treatment of people with heart transplants has improved where you wouldn't even recognize somebody who has a transplant. The same is true now of heart failure therapy, where we put heart pumps in people, or LVADs, left ventricular assist devices, where we implant a pump inside a patient so that it helps the failing heart. One of the big advances in heart failure therapy and even failing lungs in patients is known as ECMO, or extracorporeal membrane oxygenation. It's particularly important right now in the COVID era when patients get put on a ventilator and then are no longer able to be ventilated, oxygenated, and ventilated. There is no other answer for them, and a lot of those people succumb and don't survive. We have the therapy and the ability now to put people on a heart-lung machine at the bedside and support their body while their lungs don't work. In COVID, it's their lungs that don't work well. As well, their hearts may be affected, and it does the work of the heart and the lungs. What we all like as heart surgeons, it's somewhat of a cowboy mentality of we all think we are the best at taking a patient who has no chance and giving them back their life and the chance. It's really what we were cut out to do, all of us. Everybody at CTVS has that same drive and that same fulfillment of doing our jobs every day.